The last company that we're going to talk about is Boston Scientific. Boston Scientific has their sensor called heart, or their kind of heart failure suite called HeartLogic. And what it does is it combines data from 5 sensors: heart sounds, impedance, thoracic impedance, respiration, activity, and night heart rate specifically. Okay. So what makes them a little bit different is the ability to detect heart sounds. So before we kind of talk about like the composite score and what a HeartLogic report looks like, I think it's important to kind of take a step back and understand heart sounds as we know them. So when we think of the heart, we think of the heart beating and we hear kind of like a bump bump, or we think of it as like on TV when the music plays and it's like a lub dub, like as the heart rate increases. So when we think of the heart and we think of lub dub, that is our S1 and S2. So the S1 is the sound that is created when the patient has systolic events, so systole. Okay, so that means the pulmonic and aortic valves are open, blood is rushing out into the lungs and into the systemic system, and the mitral and tricuspid valves close. The S2 sound is diastole, is the relaxing of the heart. So the pulmonic and the aortic valves, or our semilunar valves, they close, and then the mitral and the tricuspid valves kind of are at their relaxing state or opening. What we don't really think of, or what we don't really know too well, is that we actually have 4 heart sounds. But so we have an S1, an S2, S3, and S4. In a normal healthy heart, really all we're going to hear is the S1 and S2. It's when the heart starts to become a little bit more diseased or have issues that we start to pick up on the other heart sounds. So that's where the S3 comes in. The S3 sound is produced during rapid filling of the cardiac cycle. So it's heard in early diastole due to the deceleration of blood. And the way I like to think of it is in a normal healthy heart, we have the lub dub where we just hear the 1 2 1 2 1 2. But as heart failure starts to worsen, we start to hear less of the S1 sound, and we hear a little bit of a continuation from the S2 into the S3. So it kind of creates this cadence of Kentucky. So it's a little bit softer in the beginning, Kentucky, and then we kind of hear more of it at the end. Another one of our other faculty members also presented it to me as kind of thinking of the S3 as the blood that is not kind of making it out and it's just swirling around. So we hear that extra sound at the end of our cardiac cycle. So the thought process here is that the HeartLogic devices use an embedded accelerometer to detect the vibrations that are made during these heart sounds, which are really just the contractions of the heart and the valves actually opening and closing, right? So the sounds are associated, the device picks up on it with the accelerometer, and it measures it in milligravity. Sorry, I'm getting excited. I'm just tripping over my words here. So we know that hearing more of an S3 sound can be an early indicator of heart failure and elevated filling pressures. So what the HeartLogic sensor does is if we have a decrease in S1 and an increase in S3 sounds, that could indicate the patient is going into worsening heart failure. So this is what we would see at the beginning of a HeartLogic report. I'll walk through one in just a few minutes. But again, it's increased ventricular filling due to congestive heart failure. And basically we can hear more of the S3 sound and less of the S1 as those patients progress. So here in this particular example, I am going to go to the next slide to show it all together with all 5 sensors that are used. Here in this example with our S3 sound, we can see that we have an increase of S3 sounds and a decrease of S1 sound. We can also see it on this bar graph that kind of shows us as we're going further and further into heart failure, what sensors are being tripped. So here we can also see thoracic impedance. Thoracic impedance has been pretty stable, and we can actually see it on this trend here as not worsening. So this is also another word of advice or like a best practice that I look at every time I'm looking at these reports. Always look at your scale. Okay. So what I mean by that is every company will have some type of scale or range their X and Y axes, right? Axes. So here we can see for thoracic impedance that my range is only from 46 to 54 ohms, which at the end of the day is only an 8 ohm difference. So always use your scale because this can look scary, like we're having ups and downs here, but always kind of take a step back, look at what has been kind of calibrated by the website or by the heart failure suite itself. We can also see going forward that the patient's respiratory rate has gradually increased, their night heart rate has also increased, and their activity stayed decently similar, but did take a little bit of a hit at the end because they're probably feeling very symptomatic. We'll talk a little bit more going into the case studies here, but for HeartLogic, nominally, the HeartLogic index is set to 16. So anytime your score gets above 16, it trips an alert, and then you have a recovery period. So I'll walk through a couple examples in a minute, or an example in a minute. But another thing that the HeartLogic devices add into their kind of heart failure suite is sleep incline. So it uses the embedded accelerometer, just the same one that's used for the S1 and S3 sounds. And basically how many pillows that the patient is using to prop themselves up with, or if they're now sleeping in their recliner, we can see that through these as well. Boston Scientific also does have a corresponding weight and blood pressure cuff, a weight scale and blood pressure cuff that can be ordered for the patient. This is not given with every device and would have to be ordered through the company. Okay. So again, we can use more information such as our AFib burden, any type of therapy given. All of these play a role. And one thing might be normal throughout. It's just where we start to pick up on little things to help us understand how this patient might be feeling. So with that, I think we'll pause for a quick second as we transition into case studies, but I don't know if there are any questions in waiting for us, Greg.
Amanda, thanks for walking through that overview on some of the different tools that are available in the suite. Right now, it looks kind of quiet on the Q&A chat line, so I think we're probably good to advance into your case studies and see some of these tools in action.
Yeah, definitely. Thank you, Greg. Okay, so the first one we're going to talk about is a case study with HeartLogic. So again, this is Boston Scientific. Again, nominal through the device when you turn on HeartLogic is 16. So that is your index. So that means all of these pieces of information are getting put together in order to create that score. And as soon as that score index goes above whatever you set as the threshold, you can change it. Whenever you go above the threshold, that is going to trip an alert for these patients. So as we can see here for this particular patient, I drew this red line in just to show where the threshold is. We can see that this patient in September, October, initially tripped their HeartLogic alert here. And we can see that this patient had an increase all the way up to 50 or so for their HeartLogic failure index score. You can also notice one thing I want to point out here is once the patient tripped, you can see that this dotted line changed and went to a level of 6, which we can also see over here. This is called your recovery threshold. And the reason behind that is if I go into heart failure and I am right at the cusp of a level 16 for my composite score, and I start to feel slightly better that my score goes to 15, I'm still at risk for going back into heart failure, or I'm really not that much better. So this recovery threshold drops to 6 once the patient trips an alert here, because we want to make sure that in order to declare them out of an area of concern, that they have gotten themselves in a better position, if that makes sense. So here we can see that the patient kind of went into worsening heart failure. Something changed, right? We probably called them, the clinic called them, the physician called them, and something changed where they stabilized. So they're probably feeling better. And then as time went on, we can see at the beginning of January, they started to trip again, or they tripped again, and then probably symptoms started to occur. And as we can see on our contributing trends down here, our S3 sounds were getting worse. Our S3 to S1 ratio was also getting worse, less S1, more S3. Thoracic impedance was slightly different. And we can see the respiratory rate worsened a lot and night heart rate. So this is what it looks like put together for you guys. The red lines here, just to kind of, since I couldn't put it all onto one page, indicate when the patient tripped their HeartLogic alert. So we can see here that the patient's S3 sounds, S1, thoracic impedance, respiratory rate, and night heart rate are all off to the left, with kind of like the average over the however many days it takes its information from. So you can see on this red line here, when the patient initially went into that heart failure alert status, our S3 sounds were kind of increasing. We can see our S1 stayed pretty stable. Thoracic impedance did take a hit, and our respiratory rate stayed decently stable, as well as like our night heart rate took a little bit of an up and down to it here. And we can see once once something changed for the patient, whether they were hospitalized or given different types of medication to kind of help, we can see those trends kind of revert or go back to a more normal or hopeful level. So we can see here the patient's S3 sounds decreased while the S1s increased. We can see a spike in our thoracic impedance. And again, higher is drier. We can see the respiratory rates went down, night heart rate went down, all the way until they tripped again. And what I think is interesting about this particular case study is that this patient tripped at the beginning of January, but you can kind of see the scale or the trends stay pretty stable with some increases here and there based on the score or the suite, I forgot the word, the diagnostic that we're looking at. But you can see here close to the very end, like at the beginning of March is when we start to see like sudden uptick. So especially in respiratory rate. So if I'm looking here right around March 1st, this respiratory rate has been pretty stable. So like this patient's maybe not noticing too many of their symptoms. Their breathing is pretty normal, maybe. Maybe they're feeling a little bit more tired, or they feel their heart racing a little bit more. But you can see here that this patient probably started feeling more symptomatic right at the beginning of March, well into this kind of HeartLogic alert, right? So I think that's also important to note is we don't want to necessarily wait for these patients to get to a specific point before we intervene. But again, it varies from clinic to clinic on how things are handled. I don't know if Dawn or Tammy, you have any thoughts? It is what it is, right?
I think it's just a clinic. It's something that the clinic needs to decide initially
Yeah.
on when they want to call the patient. Do you want to call the patient when they cross the threshold? Do you want to call the patient when they're above a threshold for a certain amount of time? Or do you want to wait until the patient's, sky high and then call the patient?
Right,
So,
right. And there are probably other factors involved here too, but yeah, it does vary from clinic to clinic. Exactly. So just another point as to why it's important for us to, monitor these patients and use a bunch of different tools to kind of help us, because we could have called the patient on February 1st and they might have been feeling okay. Right. And so we know that once patients have an onset of symptoms, hospitalization can be pretty closely behind that. So definitely good to use all of these pieces of information.